Okay, so what we're going to do first is we're actually going to perform hand hygiene. Okay, after doing that, we're going to enter the patient's room. We're going to don our gloves. In this case, I don't have any gloves, but we're just going to improvise like we do. So we're going to provide patient privacy and just identify. I introduce myself to the patient first. So hi there, my name is Saeed Hashimi. I'm a nursing student from Douglas College, and identify the patient using two identifiers. So ask for their name and check that against their wristband, and everything looks good. Check for any allergies. The patient says they have no allergies, no allergy bands present, and then I'm going to explain the procedure to the patient. So Mr. Brown, I have a dressing change to be performed for your coccyx wound area, and it's an order. So do I have your consent and ask for their permission? The patient gives me consent to perform this dressing change, and I'm just going to explain the procedure. So we're going to irrigate the wound, assess the wound, and then apply some packaging to the dressing area, so to the wound area. And it can be a little bit painful, so assess for their pain using PQRST, and ask the patient if they need any analgesics, pain medication analgesics. So the patient says they're okay. They've received hydromorphone 2 milligrams just 5 minutes ago, so they're okay with their pain. They don't need any PRN medications right now. Lastly, I would ask the patient if they need to go to the bathroom before we start the procedure. The patient says they're okay, and so we're going to begin the procedure by placing the patient into the sideline position, placing the blue pad underneath their coccyx area. So their head is this way at 12 o'clock and their feet is this way at 6 o'clock. So the dressing looks dry and intact. Again, I would have my gloves on at this point, but I don't have gloves on me right now, so we're just going to pretend like I do have gloves. So it looks like we have moderate amount of serous sanguineous fluid on the dressing, and looks like we have the peri-wound area actually looks dry. It looks intact. There's no macerations, there's no odor, no signs of redness, edema, erythema, or swelling. So that looks good. There's no signs of infections there. We're going to keep that there for now. We're going to take off our gloves, throw that in there, perform hand hygiene, and clean our working area. Now we have our dressing tray. So before we open the dressing tray, we're going to look at the date. We're going to look at when it expires, and if it's to see if it's moist or open or not, if there's any tears. Nothing like that, so we're going to use this tray. And using the 1-inch border, we're going to open it away from ourselves, and to the side, and to this side. I have my forceps here. Just going to fix this. Put this on the side. Oops. Okay. And again, 1-inch border, so keep that there. We're going to pour our saline solution from the side, not from the bottom or top. So there we go. And then when we have enough, we're just going to put that back. Now we're going to dump all our supplies into our sterile field. So taking one step back, opening up, and just kind of dumping that there. Our measuring tape. Taking one step back and then kind of just placing that into our field. And then same thing with the Q-tip. Gotta be very careful with these things. And then lastly, our irrigation catheter here. So there we go, we have everything now. Well, at this point, what I would do is don gloves again, and then take out the dressing using my forceps. So I'm donning my gloves, removing my dressing, and then, oops, my two 4x4 gauze pads, which I'm removing right here. Perfect. I'm just going to show the wound to the camera so that you guys can see. That's what it looks like. Perfect. So now the next thing I'm going to do is take off my gloves, perform hand hygiene, and I don't actually need this forceps because it's just useless at this point. Perfect. So next thing I'm going to do is don my sterile gloves, which is what we're going to use. And again, I can use the bed as long as it's not near the contaminated area. So we can just use this area right here. So kind of don our gloves. again, making sure I don't face my back against my sterile field. So just gonna do this quickly, and using just the 4-finger tips, I have my sterile gloves. So what I can do now is I can actually touch everything here. So the first thing I'm going to do is actually measure the wound. So just by looking at the wound looks like we have round edges. We have about, I would say, 70% of granulation, 20% of slough, and then 10% of eschar. And we're going to measure the wound now from head to toe. So 12 o'clock to 6 o'clock, it looks like we have 4 centimeters. And then width is about 2 centimeters without touching the wound actually. And what we can do next is actually get our Q-tip, check for any undermining or tunneling. And it looks like we do have undermining at 6 o'clock, and it stretches to about 7 o'clock. Okay, so we do have undermining from 6 to 7 o'clock. We're just going to measure how deep that is. So using the Q-tip, so it's about, so it looks like it's about 0.6 centimeters deep. All right, so now what we can do is actually throw that Q-tip away. Now the last thing we're going to measure is the depth of the wound. So we're going to place that inside, and it looks like we have about 1 centimeter depth. Perfect. Okay, so when we're doing this, we actually want to go to the deepest part of the wound. We want to find the deepest part, and then that's how we measure that. So it looks like the deepest part is at 1 centimeter depth, has a 1 centimeter depth. So we can actually throw that out. We don't need that anymore. So upon my assessment, there's eschar, there's the wound has undermining, it's deep into the it looks like it's up to the subcutaneous tissue. There's no signs of bones or tendons, so I would say that this is a stage 3 wound. Perfect. So now that we've determined that, we're going to irrigate the wound. So when we're irrigating the wound, we're going to irrigate from the cleanest area, which is from the top to the bottom, and to the dirtiest areas, which is from 5 o'clock to 6 o'clock. That's where the eschar, the undermining, and the slough area is. So we're just going to start from the top, work our way to the bottom. And again, we can go close to the wound, make sure we hit the undermining area as well. And once we have irrigated this completely, what we can do is actually throw that away. We don't need to irrigate it anymore. And now we're actually going to clean the wound using our forceps. So you're going to clean it again, just from top to bottom. And you're going to clean it until you get rid of all the debridement and all the dirt in that wound, and until it's clean. So once we see that the wound is clean, we can actually throw that into the garbage. And once we have cleansed this enough, what we can do is actually pack the wound using 2 4x4 gauze pads. So what we're going to do is actually wet this gauze pad, but do not wet it enough, because we don't want it to be too wet. Okay, so it is a bit dry now. So it's not too wet and not too dry, so just in between. So what we can do is actually we're going to pack this wound now. So this is a 4x4 gauze here, and I'm just going to kind of make its way, spread it around. Okay. And this is another pack here. So we're going to pack this wound, make sure it doesn't come outside. All right, so we took out 2 4x4 gauzes, and we're putting in 2 4x4 gauzes in. And yeah, so whatever we put out, we have to put that in. So now what we can do is actually pack this wound with dressing, any type of abdominal dressing or just normal dressing. So I can actually put this down and obtain our dressing here. So we're just gonna open that up. And without actually touching the dressing, what we can do is actually open this up and apply the dressing onto this area. So once we have that, this is no longer a sterile procedure, right? We have a clean procedure now. So what we can do is actually pack that or seal that. Before we do that, actually, what we can do is we could have applied a skin protector around the peri-wound area, but I don't have a skin protector with me. But usually the good practice is to apply a skin protector around the peri-wound area to protect the skin around the wound from being infected or from any type of complications, skin barrier complications, skin tear complications. So what we're going to do now is apply this. Tape right there, and then one over here. And then make sure not to seal it too tight, right? Okay. And we're going to document what we found out and how much we put in and how well it was approximated by the client. And we're going to put the client back into their normal position. And obviously we're going to throw everything away here. And yeah, what else? So we would assess if they have any pain after the procedure or during the procedure. You want to make sure whenever you're irrigating the wound, you're kind of cleaning the skin around the wound as well, because when you're irrigating the wound, the solution can actually drip down from the skin. So that's also important to do. Again, apply skin protector, some sort of skin protector that might be ordered from your doctor's order, or it might be from your wound care nurse that might have ordered them. You can apply any type of skin protector around the peri-wound area. And yeah, that's about it. Thank you.